Hello, welcome to Support Groups 101. This presentation is a basic primer on starting and sustaining PH support groups with the help of PHA. Our PHA volunteer services staff includes Debbie Drell, our senior director, Andrew Hicks, our administrative associate, Tracy Delaney, our office assistant, and me, Michael Knoppen. I am your support group associate, and I will be leading you through today's presentation. To begin with, I'd like to talk a little bit about the origins of PHA itself, because they coincide very closely with what your project is in starting a support group. PHA started as a support group. We tell the story of the kitchen table, how the Pulmonary Hypertension Association was founded in 1991 around a kitchen table at a patient's home. It was founded by 3 patients and a family member. And this was, if you think about it, not only the origins of PHA, but the first support group. So PHA started as a support group, and so not only are you part of something special today, but you are part of a long heritage of support groups. So think about that as you continue your journey in starting this group. And a photograph that you'll see there is the kitchen table as it appeared in 1991 at that very first meeting. And today, that kitchen table resides here at PHA headquarters in Silver Spring. We are guided by several principles, one of which is to find ways to prevent and cure pulmonary hypertension, or PH, and to provide hope for the pulmonary hypertension community through support, education, research, advocacy, and awareness. And while we have many pillars, you'll notice that the very first is support. A quote that we like to say and repeat is one from our president of PHA, Reno Aldrighetti. Any person whose life has been touched by PH has the right to fight back as much as health and interest allow, and we see support groups as being a part of that. Before we continue, let's talk a little bit about what a support group is. For our purposes, it is simply 2 or more people with PH. That's all it takes to start and sustain a support group. As long as 2 people are coming together, PHA wants to be there to help you, and we have resources that will make that possible. Not only is a support group fairly straightforward in what it is, but it's fairly straightforward in why it is. Support groups provide an opportunity for knowledge, support, hope, and empowerment. These are sort of the 4 basic elements of what a support group can provide to folks. In terms of knowledge, we think of the medical education that can happen at a support group. If you have medical experts come and speak to your group, or you share other kinds of information, webinars from PHA, and other things like that, you're giving folks an opportunity to learn. So knowledge is one of the core elements of why a support group. The second is support. It sounds a little redundant, but this can't be overstated. Coming together, establishing a sense of community, and ending any sense of isolation is core to what a support group is and can do. From that, we can see hope. Hope is that sense of togetherness and community and what can come next. And we get a lot of that by coming together in support groups. And empowerment. Empowerment is something that we talk a lot about at PHA, and we think of it as that part of coming together in support and learning together and going forward with a mission, with a sense of advancing understanding about PH, fighting for research dollars, and other things like that. And that is something you can get at a support group. So as you are thinking about the great legacy of support groups, what a support group can look like, as few as 2 people or as many as you can find and bring together, and why you might want to have a support group, knowledge, support, hope, and empowerment, it's also a good idea to think about the basics of planning a support group. Now, it might seem a little overwhelming at first, but I promise you that the first step is simply to pick and plan a first meeting. selecting a time and a place to meet, contacting us at PHA to request postcards and food sponsorship, and preparing a straightforward agenda. That's it. That's your first step, is getting together that first time. I promise you that there will be a wonderful response to that, and you will grow organically from there. So your first step is planning a first meeting. Next, think about where to begin. And by that, I very literally mean where. Location is key. Think about where you would have that first meeting. Would you meet at a hospital? Hospitals can be great because that can be a place that a lot of PH patients are already aware of. It might have good parking. You might have help from the nurses and doctors at the hospital to start that group. They may be able to provide you a free conference room. So hospitals could be a great place for a meeting. Restaurants and coffee shops are also good places to meet. They can have, again, good parking. They have food there. Food is really critical to having a good meeting. And we'll talk a little bit more about that in a minute. But restaurants could also be good because they can have good access to highways and public transportation. People might know about particular restaurants in your area. So restaurants and coffee shops could also be a spot to have a meeting. Libraries can make good meeting spaces, especially libraries that have conference space with maybe AV equipment if you'd like to show PH webinars or things like that. Churches can be good spaces too. If you or folks you know have connections to local churches, many of them will provide free spaces for people to meet. A person's home is an option, although I wouldn't necessarily recommend that as a first meeting space. You may want a chance to get to know how many folks would be coming to your meetings and things like that, and get a sense of who your local PH community are based on having a meeting or two before you would have it at a home, but a home is certainly an option. We also have options to meet online, and we can direct you to those resources as well. In any case, whatever location you want to have, consider a few things. Is the space free? PHA does not have resources to help you pay for meeting spaces, and we wouldn't want you to take on that burden yourself. So try to find free meeting spaces. As we said above, hospitals, restaurants, libraries, churches, all of these can have free meeting spaces, so we encourage you to look at those. Is the location wheelchair accessible? You may have folks who have wheelchair usage. They may use oxygen. So you want to have a space that's very welcoming to folks who may have those accessibility devices. Is the location close to affordable or free parking? Parking is key. You don't want to be able to have to get out of the car and then walk several blocks to your meeting space. You'd like it to be pretty close at hand, and you don't want to pay a whole lot. Again, PHA doesn't provide any kind of payment resource for parking, and you don't want you or your members to have to shoulder that burden. And is the space okay with bringing in food? As I said before, and I will say it a couple more times, food is key to having a great meeting. It helps people improve their mood. It's a great icebreaker. And of course, some folks may be traveling quite a ways to your meeting, and food can help them to feel well during the meeting. So these are some key questions to ask about any location where you might want to have a meeting. Is it free? Is it accessible? Is it close to affordable or free parking? And will it allow you to bring in food? Next, think about when to meet. After you've decided where you want that to be, think about what days of the week, what times of the year, how often to meet. Consider weekdays versus weekends. As you think about that, weekdays may be a good option because you can find more free spaces. For example, churches may be more willing to give you a conference room during the weekday. The same with hospitals, may be open during certain times and have their conference rooms available during certain times, only during weekdays. Weekends, however, are a good option in case you want to make sure that not only patients but also caregivers, so that anyone who might still be working who has PH, or anyone who's working who is a caregiver for someone with PH, can also attend. So weekends are a good option that way. How often would you like to meet? Think about the size of your group, the interest of your group, and how often they want to meet. So this is probably a question that you can bring to your group and that the group might be able to answer. How often do we want to meet? Many groups meet monthly. Most of our groups meet either monthly or every 2 months. However, also a great many groups do not meet during the winter, for example, if they are way up north, where things get really snowy and it's simply too dangerous or difficult to go out in the winter. So that's something to consider about your meeting as well. If you meet at a hospital, you may want to meet during clinic days when so many patients are going to be there already for their doctor's visits. So you're sort of maximizing people's opportunity at the hospital. But ultimately, the first consideration is setting a date for your first meeting. Think of all of these considerations, weigh them all carefully, and then make a decision about that first meeting date. Pick a date that works well for you and let PHA know, and we will help you set up that first meeting. Also, in considering your first meeting, think about what you'd like to talk about. In addition to your first meeting, you will probably be getting together again, and speakers and topics will be a really crucial part of what you do at meetings. Topics could include things like meet and greet, so purely a social get-together. We're going to get together, get to know each other, share our stories. Topics could be about exercise, travel, treatments, family, relationships and kids, psychosocial issues, etc. There's all kinds of topics, and we have a number of resources available to provide to you. And we can also connect you and network you with other support group leaders so you can share those ideas among yourselves. For a first meeting, we strongly encourage having a meet and greet so that you have an opportunity to get to know one another and to share your stories. Sometimes that's really the best way to lay a foundation for a support group. In addition to topics, you'll want to think about speakers. So again, while your first meeting may be a purely social one where you're getting together, getting to know each other, and getting to know what that group may want to see in the future, your subsequent meetings may have speakers. We'll talk a little bit about industry sponsorship, and industry can oftentimes provide sponsorship of food and speakers. They can nicely pair those things and help you that way. But if not, you'll want to think about the kinds of topics you want and a good speaker for that topic. If you're doing medical topics, for example, you may want to have a doctor or a nurse or a pulmonary rehab specialist or someone else with the kind of expertise in that area. If you're doing a psychosocial issue, you may want to have a social worker, a therapist, or even a clergy member, provided you do make it clear that this is a non-sectarian meeting and not a religious meeting, but that this person has particular gifts in helping people go through difficult conversations. So you have a lot of options with speakers, and we're always here to help brainstorm and offer some other ideas as well. So one of your jobs as leader is going to be networking with your local PH community, and that's going to include some of those experts you'll be able to bring in as speakers. Again, you'll see it listed there: doctors, nurses, EMTs, pulmonary rehab specialists. All of those folks make excellent speakers. Another great tactic to try in your first meeting is to plan ahead a little bit. So we've talked about how we're getting together, where we're getting together, when we get together, and what we get together to talk about. We have a wonderful activity that we recommend to help you plan ahead for your meetings. If you as the leader give everybody a minute to write down topics, you hand out a piece of paper and a pen, and then after a minute, you go around the room and let everybody say one topic, and you as the leader are keeping a master list of those ideas. You go around until everyone has said all of their topics. You can take this list, and it may be a fairly exhaustive list. You can send this to your industry reps. We'll talk about them in a moment. And you can also send it to us here at PHA and say, so these are the topics we're interested in talking. Do you have any recommendations or ideas about speakers? And can you provide food sponsorship at those meetings? It's a great way to plan your meeting. I think that you'll find that industry can be extremely helpful finding speakers on a number of topics, from oxygen to travel to new treatments to pH basics, and that they can then also help provide food at that meeting. So this activity could be a great activity for even a first meeting. So if you plan that social meeting, you've picked your place and your time, and you've invited everyone to come, you go around the room and everybody gets to meet everybody else and share their story, and then you could facilitate, as the leader, you could facilitate this activity, and that will help you plan for future meetings. It may also give you an idea of how often you'd want to meet. If you come up with a lot of topics, you may want to meet more often, so you can go through those and get together to talk about those things more frequently. And now, again, I want to talk a little bit more about food. My motto is, if you feed them, they will come. So you have two options here in either having sponsorship or not having sponsorship. Based on our 2014 support group leader census, 99% of our meetings, 99%, have food at them. Food, as I've said before, is a wonderful icebreaker. It's a great help in ensuring folks have a positive mood, and it can also be a great part of a meeting. If you want to talk about diet, you can include that. Food is just a really essential part of meetings. Also, as a rare disease community, you may already be aware that folks will travel some ways to come to a meeting, to meet other folks with PH, and to be there together and to have fellowship. And so they may be traveling a long time, and having food at the end of that journey could be really helpful. So PHA can help provide industry rep contacts. We have a special form that we will send to any PHA affiliated leader that will give you national contacts. You can then reach out to industry reps and gain their support. Just get in touch with them and say, I'm a support group leader for a PH support group, and I'd like some help. Let them know the topics you're interested in and having speakers and when your meetings are, and they may be able to help you. We also have an excellent program called the Support Group Central Fund. This is run by PHA thanks to generous sponsors that you can learn more about on our website, and we'll get to that information in a little bit as well. The Support Group Central Fund can be used by support groups at any meeting. There's no limit on the number of times you can use it. It can be used as a hardship or via receipt. So you can request the Support Group Central Fund and say, I need you to help me pay for this in advance, and we will send you a check that will cover things. You keep your receipts, return any money not used, that sort of thing. Or you can make the request and say, no, I can just be reimbursed. Then you would pay or provide payment somehow and return those itemized receipts to us, and we can reimburse you. Either one of those is a perfectly acceptable option, and as I said, there's no limit to the number of times you can use it. Now, there are some limitations to the Support Group Central Fund. I don't pretend that it is a magical bottomless thing. We provide up to $15 per head, so per person, for any regular meetings. We double that once a year for a special meeting. So if, for example, you wanted to have a summer barbecue or a winter holiday party, you would be able to make that once a year request, which would cover up to $30 per person. Now remember, the Support Group Central Fund has some limitations in terms of what it can pay for as well. It only covers food and beverages, and non-alcoholic beverages, of course. It will not help you provide money for utensils or for meeting spaces or anything else, just the food and the beverages. As for utensils, we have another program as part of the Support Group Central Fund called the Party Pack, so that if you are having a meeting, let's say in a conference room, and you've bought food from a grocery store, you could bring that. You can request a party pack, and so then we would send you that Support Group Central Fund party pack with the appropriate sponsorship labeling and all of those things, including plasticware, napkins, so that you can enjoy that food in that space. You wouldn't necessarily need the party pack for a restaurant per se, so it's not required and it's not necessary at every meeting. I only mention this because the Support Group Central Fund is an excellent resource. We encourage you to use it. Again, there are no limits to the number of meetings that you can use this for. We absolutely love when you call us and need help with it. There's an easy online form that you can use to notify us of your meetings and then immediately request Support Group Central Fund sponsorship. So it is a great tool, and we strongly encourage you to use it. Just remember that there are some limitations and know what those are. In addition to industry reps and the Support Group Central Fund, we encourage you to use your network to ask around. Ask other leaders if they have options or they've had luck with other folks volunteering sponsorship for them, or even if hospitals have programs to sponsor support group meetings. Some of them do. So be sure to ask around, use your network, use the industry contacts that we will send you, and of course, use the Support Group Central Fund. Now, if you choose not to have a sponsor, which is entirely an acceptable choice, you can have a brown bag lunch, you could do a potluck, you could have a special meeting where you ask everybody to cook up their own favorite heart-healthy, low-salt food item and bring that so everybody can share their great recipe and their great food with one another. By all means, be creative, but just remember you have a lot of sponsorship options. Whether or not to have sponsorship is up to you. One of the first things that newer leaders will ask us is, what's the right way to have a meeting? Now, I cannot emphasize enough that there is no right way to have a meeting. Every meeting is different. Every support group is different. We encourage and embrace that diversity. That being said, we've had a lot of responses that show some trends, and I want to share those with you. 46% of our support groups meet at a hospital or in some medical setting. 14% meet in a restaurant, 13% in a library, 12% meet in business or community centers, and 8% meet in churches. And there are a few other locations, sort of random or changeable locations where support groups will meet at different locations from time to time. 61% of our meetings occur on Saturdays, 70% of meetings happen in the afternoon, and 70% set an agenda. So these are some of our strongest trends among support groups, and I share them with you to indicate that those trends may be speaking to what has worked for other leaders. So meetings may have started during the weekday, and they moved to Saturdays in order to, as I say, encourage those who work or those caregivers who work to be able to attend and make that meeting possible. 70% set an agenda, and I think this speaks to leaders knowing that there's a lot to do in a meeting. There's enforcing privacy rules, which we will get to in a moment as well. There's people to thank. There's opportunities to share news from PHA and what's going on in your community. All kinds of things are possible to do in a meeting. So setting an agenda is a great way to organize all of that and make sure that you get everything sort of covered. But that being said, there is no right way to have a meeting. So now we've talked about the legacy and history of support groups, why support groups, how a support group is as few as 2 people can define a support group, can make a support group. We've talked about the importance of planning a first meeting and how really all that takes is thinking of where and when and what to talk about. So now you know all of the basics of meeting planning and all of this history. So what's next? Making it official. how you do that is a simple phone conversation with us here at PHA. We want to get your verbal confirmation of 3 pillars of the support group program. And those 3 pillars for us are privacy, inclusivity, and integrity. Privacy for us means respecting the privacy of your support group members, not sharing their contact information, and not sharing information that they revealed during the support group meeting. One of the ways we make sure that's possible and that that's understood is by reading a confidentiality statement at the beginning of every meeting. We will provide you with that confidentiality statement, and we encourage you to read it at the beginning of every single meeting, even your social meetings, because things could come up that are very personal. And we want people to feel safe at these meetings, and we want them to feel that they can share. Inclusivity is also very important. We do not restrict participation to anyone. We do not discriminate based on any kind of discrimination you may have ever heard of. We want anyone whose life is affected by PH, anyone whose life is affected by PH, to feel welcome at a support group meeting. And not only, as I say, do we want them to be able to attend, but to feel welcome. So inclusivity is part of your job as a support group leader, letting everyone know that they're welcome. That can be as simple as greeting everyone when they come to the meeting, shaking hands, making sure everybody knows who everyone else is, having name tags available, or going around the circle to introduce everyone. That's part of your job in making sure everyone feels included. Another part of that is facilitating conversations so that everyone feels included in the conversation. We can provide some fairly basic meeting running strategies and tips from our resources and from other leaders on how to make sure that that happens. But I think that you could also imagine what a support group may look like, where one person may do all the talking, other people may feel more reluctant to speak, and how part of your job is just facilitating that and making sure there's some balance so that those who are reluctant to speak may have the opportunity to speak, so that you're sort of giving them that space, welcoming and encouraging them to speak. And those who may seem to monopolize the conversation understand that that is not necessarily appropriate for the meeting, so that everyone gets a say. That is all a part of leading an inclusive meeting. The final point is integrity. For us, integrity means by patient, for patient. So every support group needs to be led by a patient or have a patient as part of the leadership team, or be actively searching for a patient leader. We have been approached by many hospitals, clinics, doctors, nurses who want to start a PH support group, and we encourage that. We really couldn't do this without them. They are a huge part of this community. We welcome, encourage, and are grateful for them. That being said, we also feel that the patient voice is critical in support groups. To that end, we say every group must have a patient as a part of the leadership team or be actively seeking that. Now, I say leadership team because some groups have multiple leaders. We call them co-leaders. Some groups have a main leader and a kind of a vice president, if you will, a secondary leader. Some groups have a main support group leader and have a team of people with different responsibilities. Whatever that structure looks like for you is perfectly okay with us. We are willing to work with you on that, provided there are patients as a part of that support group leadership structure. Membership in PHA matters. I recently spoke with our founding CEO, Reno Aldrighetti, and asked him a little bit about support groups that he'd been to. And he mentioned the first support group meeting he'd ever gone to in the late 90s, where he stood up in front of the room and he asked everyone, who here is a member of PHA? And everyone raised their hands. He later went back and did a little research and found out that only about 10% of the people at that meeting were actually official PHA members. He said the good side of that, the good news, is that people feel like members of our community. If you go to meetings, if you have read a Pathlight, if you have donated, you feel like a member. But unless you've made the actual step to register, to apply for PHA membership, you aren't going to be counted in those numbers. And those numbers are really important. So we want you as a support group leader to set an example by being an active member of PHA. Not just an active member of your support group, but an active member of PHA, which is this global network of people fighting to improve and extend the lives of people with PH. Being a member of PHA gives you a lot of benefits. First, you're going to be notified of events in your area. You will be receiving those postcards that are so famous for our support group meetings. You'll learn about any other programs in your area, medical education programs, on the roads, conference, etc. You're going to learn about events in your area, fundraisers, fun walks, all of the wonderful events that we do, you learn about as a member of PHA. You're helping the cause. By becoming a member of PHA, you become part of the tally of people who are affected by PH. That's the kind of number that we can use in lobbying for laws to help people with PH and for lobbying for research dollars. It's absolutely critical to be a part of that count. And that's what PHA membership gives you. We even waive fees for financial need. We understand that folks with PH and folks affected by PH are under unfair and extraordinary financial burdens. We understand that, and we care about that. And for that reason, we can waive membership fees. It's most important, in our opinion, to be a part of the membership network. It's more important than any fee could be. So we want you to be a member, and if you can pay for your membership, that's wonderful, and that money will go to great resources and great research. And if you can't, please let us know. We will help you. We will waive the fee. We want you to be a part of the PHA membership network. As a member, you also get a discount on the survival guide, and you can apply for conference scholarship. These are all wonderful things that people hear and know about PHA that make them feel connected. These are events that they enjoy. Conference is so fondly and so often called a family reunion and gives us opportunities to learn so much about where we are in that fight for the cure. Having that survival guide on hand is also so critical. And of course, as a member of PHA, you will receive your Pathlight magazine, which is beautiful, educational, wonderful resource material that we provide to members. And all of these things together not only make membership meaningful and enjoyable and worthwhile, but again, they put you in that count that helps us do so much of the work that we do. One of the elements of leading a support group is ensuring that people come to the meeting. So we want to talk a little bit about getting the word out. There's a number of ways that you can do this. There's community calendars and newspapers. You can contact those folks in your immediate area and say, I'm doing this meeting, here are the details, please add this to the community calendar, put this in the newspaper. You can use online resources like Facebook, Craigslist, or Meetup.com to advertise your meetings. And perhaps most effectively and most importantly, let us know. Let PHA know. We will send postcards to people in your area. Anyone in our membership database will get that postcard saying, there's a support group meeting going on in your town, in your neck of the woods. We can send email blasts. We update a calendar so that anyone can go onto our calendar on the PHA website and see what meetings are going on in the near future. And we can post all of that information on our website as well. You can create a business card for yourself as a support group leader using one of the many, many free business card resources out there. I noticed Vistaprint makes this possible. There are other resources as well. You can create a business card and send that to various members of the community and so on, which leads me to the discussion of medical and healthcare professionals. This is a great way to get the word out. Now, because of HIPAA, which governs privacy of people's medical information, doctors can't simply give you patient information. However, you can give them your information. So as I said with that business card, for example, you could approach local doctors and say, I would like you to put any PH patients in touch with me. I want you to feel free to share my contact information with your patients. And then doctors can do that. You're giving them permission to do that. So having a business card or creating flyers, we have a flyer template that we can send you to notify of meetings, and giving that to medical professionals and healthcare professionals in your neck of the woods is a great way to get the word out about your meetings. You can do the same thing with industry reps, those folks we've talked about for various companies, pharmaceutical and drug companies, who can also help to spread the word. Let them know a meeting is coming up, and they can let folks in their contact lists know who might be interested. I just want to show you a quick copy of what those postcards look like when you request us to send them out. So there's a simple online form, and I'll show you what that page looks like and where you can do this, that allows leaders to request notification of meetings. And this simple form also allows you to request the support group central fund sponsorship at the same time. This is what the postcard will look like that would go to community members to notify them of meetings in their area. It will tell them the date and the location, and it will give them your RSVP information. It gives all of that information about the meeting so that you can get the word out. Another really important factor is building your network, building a community, building a coalition. So reaching out to foundations and organizations that address associated conditions, you know, those who have PH secondary to or primary to another associated condition, letting those folks know that a PH support group is in that neck of the woods can be really helpful. They may know of and be able to put in touch people with PH in those communities who haven't yet been connected to PH resources. So reaching out to, for example, the Scleroderma Foundation, COPD, lupus, sickle cell, liver disease, congenital heart disease, all of these are associated conditions. And those associations that address those conditions specifically may be able to contact people in their communities who also have PH, who also have an interest in your support group. There are a number of general cardiac and pulmonary organizations as well, the American Heart Association, Lung Association, and the North American Thrombosis Foundation. We have resources for you to build that network as well. We have a Facebook group just for support group leaders. It is a closed group facilitated by PHA staff, which allows leaders to focus on meetings, topics, leader issues, where they can share their stories, their successes, their struggles. They can vent and praise and brainstorm. It's a wonderful place only for support group leaders. We also have a leader forum in MyPHA or myphassociation.org, which is a new special platform that PHA has created that is particularly excellent at allowing you to see archived conversations and to access resources immediately. You can build your network using the PHA website as well. There's a special section of the website that is just for support group leaders called the Support Group Leader Institute. There you can find other leaders, you can find doctors, you can find industry reps, you can find all kinds of wonderful resources right there on the website. This gives you the URL for the Support Group Leadership Institute and also shows you a little bit more about what's available there. So www.phassociation.org/SG Leadership Institute. That will take you to the special leader page, which has exclusively leader information, leader resources, leader updates. This is kind of a clearinghouse for all of our leader resources, including videos and easy online forms. I've mentioned it a few times, but we have a single, simple online form that allows you to notify us of meetings and request the central fund. This single form can be filled out. It asks you to include all of the details of your meeting, to make your request for the central fund. It reminds you about what can and cannot be purchased with the central fund. It has all kinds of wonderful information in it, and it's one simple form that you fill out, and that allows us to send postcards, update our calendar, and fund your meetings. Next, I've included a very simple agenda. As I mentioned, upwards of 70% of our support group leaders use an agenda at every meeting. An agenda could be something as simple as a little notebook paper with a few items written down just to remind you. Remind you to first greet everybody, invite everyone to get food, thank the sponsor, read the confidentiality statement, introduce your speaker, and have a Q&A with your speaker. Now, as I've noted a few times, I encourage you to have food at your meetings, sponsored or otherwise. Food is a great icebreaker and a mood enhancer. Read the confidentiality statement. It has a wonderful disclaimer about seeking medical advice, which comes in handy with very opinionated members or can prevent a support group meeting from going from a meeting into a doctor's visit where one patient is asking all of their specific questions of the doctor to the point where it's really sort of gone into a clinic instead of a support group meeting. And that confidentiality statement allows you to sort of facilitate that conversation. Checking in with everyone encourages them to come back. We've heard time and again from leaders who've been leading groups for decades that the most important factor in member retention, in making sure that folks not only come to a meeting but keep coming back, is checking in. Personal connections are why people stay. They may come to end isolation, they may come for medical education, but they stay because of personal connections. And when I say thank the sponsor, I hope you'll take a minute to recognize anyone who helped you with the meeting. If you need someone to help you set up or clean up afterwards or pick up the food on their way, please be sure to thank them. Recognizing and thanking people is one of the ways that you'll be able to build your leadership team. If people aren't feeling like they're appreciated, they may not be willing to help you again. But if people are appreciated, they may want to take on even more to help that support group. And that will allow you as a leader the opportunity to know that if you're not able to attend every meeting, it's okay, this other person can help. If you need to take a break from leadership, if you go to the hospital for a little while, it's okay. You have a team that can help you. And that's really important for your state of mind as a leader so that you know you don't have to stress, you have people who can help you. And so as simple an act as thanking people at meetings can go a long way towards the longevity of your support group. I also wanted to include a lot of our PHA resources that can come in handy not only for you personally, but for your support group members, the kind of information you may want to have on hand at every meeting. For example, our phone resources. The patient-to-patient support line is the first program PHA ever came up with. It's our very first program, was a support line that connected one patient to another. The Caring Voice Coalition can help with financial assistance, and that number is available for you there. You may want to be able to connect members to the Caring Voice Coalition. There are email resources. I can email you leader manuals, which give you more agendas. I can send you meeting in a minute kits, which are sort of one-stop shops for planning particular meetings. So each meeting in a minute kit addresses a particular topic and gives you the rundown on that topic about how to find speakers, how to plan that meeting. Other email resources might include the PHA Friends, which isn't listed here, but I can give you more information about that if you need. We also will mail you a few resources. We have a starter kit that we will send you, which includes a survival guide for your support group, pins, thank you cards, and other fun freebie materials that are just great to have on hand to thank people and to share with your group. By request, we can send you materials for newly diagnosed patients, PH&, which is a series of brochures that address pH and associated conditions, and other materials. You can order all of these anytime as a leader or as a patient or in any capacity. You can order these materials anytime online at our store, and the website is listed there. We have a number of web resources, most of which we've already addressed, at least in part today. The PH Association website, www.phassociation.org, has a special page on it just for your group, so that anyone who's looking for a support group will be able to find it. They'll be able to find your contact information, get in touch, and connect with your group. It's also very easy for you to update that page, and I can tell you more about how to do that. We have that special page for leaders. Now, this is that behind-the-scenes page, which is a clearinghouse of leader resources. This is the Support Group Leadership Institute. It has easy forms to help you request postcards, update the calendar, request Central Fund sponsorship, and it includes resources like our Second Tuesday archive and our meeting materials. There's also MyPHA, which is myphassociation.org. There's a group in there just for leaders as well, and that's a great place to network with other patients and leaders. There's a Facebook group, which you can see here is www.facebook.com/groups/PHA support group leaders. And that is a closed group for leaders. So you can only get in by being invited, and we invite all new leaders to join. And from there, you're able to network with other leaders, share information about your meetings, share ideas about topics and speakers, and get other information from other leaders as well. We also have a few in-person resources. We do 2 to 3 annual leadership summits. These are regional and depend from year to year where they will be. But they're great opportunities. If you get an invitation to a leader summit, I strongly encourage you to attend. We'll be able to meet in person, network with other leaders, and share resources. We have 4 dedicated staff to support groups, and you can see there on the left, that's me from a very exciting PHA on the road. Tracy is in the middle there. She's working from PHA headquarters, and there's also a photograph of Andrew and Debbie at another PHA on the road from last year. So this is your team. We're your folks. You can get in touch with us at any time. Here's our information there. This is the whole volunteer services roster. I encourage you to get in touch with us if you have any questions. If you have questions about support groups, come to me first, and I may be able to help direct you to the other members of the team who can address your specific issues. But as you see there, there's Debbie, Tracy, Andrew, and me, and we're all here to help. In conclusion, I would say PHA is here for you. We want to help you find, lead, and start support groups. We want to help you plan, publicize meetings, and we want to help you sponsor food or help you find a sponsor for food at your meetings. We're here to help you using web resources like PH Association website, the SGLI page for leaders only, and MyPHA. Using staff time and resources. That's what we're here to do. So take advantage of that. Use us. Put us to work. We're happy to help. And using publications like newly diagnosed brochures, the survival guide, the new normal, which is a wonderful new publication of ours that tells stories of folks and their diagnosis journey, meeting in a minute kits, and other kinds of resources. And we want to help you with a network, connecting online at the PHA website, at MyPHA, and on Facebook, using the patient-to-patient support line to connect with other patients, and connect with us by email. Thank you so much for joining this presentation, attending to this presentation. I hope you've learned something about the basics of starting a PH support group. And if you have any questions, please feel free to contact us at the email addresses you see here. You can also call me at my direct extension, 240-485-0758, and I'll be there to answer your call and help in any way that I can. Thank you so much, and happy meeting.
Thank you.